I had to ask a patient to choose between his arm and $80,000. That day, I stopped believing in medicine. The call came at 6:52 a.m. on a Tuesday morning. I was in the surgeon's lounge, halfway through my third cup of coffee, when my pager went off with the code I'd learned to dread: Level 1 trauma. Factory accident. Severe upper extremity crush injury. ETA 8 minutes. 8 minutes to prepare for something that would destroy 2 lives, the patient's and mine. My name is Dr. Sarah Chun. I'm a hand and orthopedic trauma surgeon at St. Luke's Regional Medical Center. I've been practicing for 11 years. I've reattached severed fingers, reconstructed shattered bones, saved limbs that other surgeons said were unsalvageable. But 6 months ago, I was forced to do something that still makes me wake up at 3 a.m., staring at my ceiling, wondering if I'm in the wrong profession. I had to ask a man to choose between keeping his arm and paying $80,000, not because medicine couldn't save him, but because the system wouldn't let me try. This is the story of Marcus Harrison, but it's also my story. The story of how I learned that being a good surgeon isn't enough when the hospital, the insurance company, and the system itself are all designed to turn human bodies into financial calculations. And it's the story of the 11 words I'll regret for the rest of my life. When Marcus arrived in Trauma Bay 3, I knew immediately it was bad. You develop a sixth sense after years in emergency medicine. You can tell the difference between serious and catastrophic, just by the way the paramedics move, the tone in their voices, the speed of the gurney wheels. This was catastrophic. His right forearm had been caught in an industrial hydraulic press. What I saw when we cut away the temporary splint wasn't an arm anymore. It was destroyed tissue. Multiple compound fractures, that means the bones had broken through the skin in several places, compromised blood vessels, and muscle that looked like ground meat. But here's what nobody tells you about being a trauma surgeon. The injury itself is rarely the hardest part. I've seen worse. I've dealt with worse. The medical challenge, while significant, was something I'd trained for. What I hadn't trained for was what happened next. Marcus was conscious, in tremendous pain despite the paramedics' medication, and terrified. His eyes kept darting to his arm, then away, like he couldn't process what he was seeing. "Mr. Harrison," I said, trying to keep my voice calm and steady. "I'm Dr. Chun. I'm going to take care of you. But I need you to focus on what I'm about to tell you because we don't have much time." He nodded, his face pale with shock and pain. I explained the injury in simple terms. His arm was very badly damaged, multiple bones broken, blood supply cut off in places, extensive soft tissue destruction. Then I laid out his options. We can attempt what's called limb salvage, trying to save the arm through surgery, repairing the blood vessels, reconstructing the bones, grafting nerves. It would require at least 3 major operations over the next 6 months. Or we can perform an amputation below the elbow, which would be faster, cleaner, and might actually give you better function with a modern prosthetic. I expected him to ask about success rates, recovery time, functional outcomes, the questions patients usually ask. Instead, he asked, "How much does it cost?" That should have been my first warning. "Let's not worry about that right now," I said, which is what we're trained to say. "Focus on the medical decision first, handle the financial reality later." But I couldn't dodge it for long, because that's when Claire showed up. Claire works in patient financial services, which is hospital speak for the person who tells patients they can't afford to survive. She's actually a kind person. I've seen her cry in the stairwell after particularly brutal cases, but her job is to enforce the system's rules, not to question them. "Dr. Chun," she said quietly, pulling me aside. "I need to brief you on the insurance situation before you proceed." My stomach dropped. I knew what was coming. Mr. Harrison's insurance requires pre-authorization for any procedure exceeding $50,000. Claire explained, her voice low so the patient couldn't hear. The limb salvage surgery you're describing would cost approximately $80,000 for the initial operation alone, not including follow-ups. And the amputation? $25,000. Covered under emergency surgery provisions. No authorization needed. I felt something crack inside me. Something that had been bending for years under the weight of cases like this, but never quite broken. Until now. You're telling me, I said slowly, that if I want to save this man's arm, I need to get permission from an insurance company while he's lying in a trauma bay with dying tissue? I've already submitted the emergency authorization request, Claire said. But you know how this works, Dr. Chun. Even in emergencies, it can take 24 to 48 hours. And even if they approve it, his out-of-pocket costs would be around $16,000 for the first surgery. Probably $30,000 to $40,000 total for complete treatment. Here's what they don't teach you in medical school. How to weigh a human limb against a bank account balance. They teach you anatomy, physiology, surgical techniques, ethical principles like, first, do no harm. They don't teach you what to do when the system itself is the harm. I went back to Marcus. His wife, Jenny, had arrived, her face streaked with tears, gripping his good hand like if she let go, he might disappear. I explained everything, the medical options, the insurance situation, the costs, the authorization delay. The golden window we were working against, tin crush injuries. You have about 6 hours from the time of injury to successfully salvage a limb. We were already at 4 hours. I watched Marcus's face as I talked, watched the hope drain out of it, watched him start doing the same impossible math every uninsured or underinsured patient does. How much is my body worth? How much can my family afford? How do I choose between physical wholeness and financial survival? If the insurance denies authorization, Jenny asked, her voice shaking, and we go ahead with the surgery anyway, we'd owe the full $80,000? Yes, I said, and I hated myself for saying it. Plus the follow-up surgeries? Yes, I saw her hand go slack in her husband's grip. Saw the look that passed between them, a look of trapped animals realizing there's no good exit from the cage. Can we think about it? Marcus asked. And that's when I had to say something I never imagined saying to a patient. We're at 4 hours and 20 minutes post-injury. I wouldn't recommend waiting more than another hour, but what I really meant was, you have less than an hour to decide how much your arm is worth in dollars. I left them alone, went back to the surgeon's lounge, sat down in the corner, and put my head in my hands. One of my colleagues, Dr. Ramirez, sat down next to me. Rough one? Crush injury, arm, salvageable. But insurance is requiring pre-auth and the family can't afford the out-of-pocket costs. He didn't say anything for a long moment. Then, how many times is this now? This month? I thought about it. 4th. This system is broken, Sarah. I know. So, what are you going to do? That was the question, wasn't it? What was I going to do? I could refuse to discuss costs and just do what was medically best, but that would saddle the Harrison family with debt that could destroy them. I could recommend the cheaper option to help them avoid that debt, but that meant letting financial considerations override medical judgments. There was no right answer. The system had made sure of that. I went back to see Marcus and Jenny 45 minutes later. They looked exhausted, like they'd aged 5 years in less than an hour. Have you made a decision? I asked gently. Marcus looked at his arm, then at his wife, then at me. What are the realistic odds? He asked. Best. I could have given him the hopeful statistics, the best-case scenarios, the success stories. But I respected him too much to lie. But I resent too much. I said carefully, maybe a 40% chance of regaining truly useful function. 30% chance of chronic pain that never fully resolves. 20% chance of infection requiring amputation later anyway. After you've been through all the surgeries and accumulated all the debt, I saw something break in his eyes, And if I choose the amputation now, modern prosthetics can restore 60 to 70% of normal function. No chronic pain from a mangled limb. Faster return to work. I paused. Many amputees report good quality of life. The silence in that room was suffocating. Then Marcus said the words that still echo in my nightmares. How do I choose? How do I decide between my arm and my family's future? And I didn't have an answer for him. Because it wasn't a fair question. It wasn't a question anyone should ever have to answer, but I was the one forcing him to answer it. I tried to buy him more time. Told him I'd stabilize the arm as best I could, give him another 45 minutes to decide. But even as I said it, I knew what the decision would be. I'd seen this play out too many times. The system was designed to make people like Marcus choose the cheaper option. And it worked. When I came back, Marcus had that look on his face, the look of someone who's accepted a loss they'll never fully recover from. Do it, he said quietly. The amputation. Marcus, Jenny started. Do it, he repeated. I can't put our family through this. I can't risk everything on a 40% chance. I should have argued. Should have told him to wait for the insurance authorization, to fight, to refuse to accept this choice. But I didn't, because I knew he was probably making the rational decision, given the impossible situation we'd put him in. Are you certain? I asked. This is irreversible. I'm certain, he said. He wasn't. I could see it in his eyes. But he was out of time, out of options, and out of choices that made any sense. I'll prep the surgical team, I said, and then the words came out. The 11 words I'd repeat in nightmares for months. You choose. Save your arm or pay $80,000. The room went silent. Even the monitors seemed to pause. I watched his face change. Watched him realize that his arm, his actual body, had become a line item on a spreadsheet. A cost-benefit analysis. A financial calculation instead of a part of himself. Mr. Harrison, I added quickly, but my voice sounded far away. I'm deeply sorry it came to this. But sorry doesn't fix a broken system. Sorry doesn't give someone back their limb. Sorry is just what we say when we know we're participating in something wrong, but feel powerless to stop it. The surgery took 3 hours. From a technical standpoint, it went perfectly. Clean amputation below the elbow. Good bone shaping for eventual prosthetic fitting, minimal blood loss, no complications. But I felt sick the entire time. The saw made a high-pitched whine as it cut through bone. Clean, final, irreversible. I kept thinking, I'm removing a limb I could have saved, not because medicine failed, but because money did. When I closed the final suture, I stood there for a moment, staring at what used to be Marcus Harrison's right forearm, now wrapped in sterile drapes on a surgical tray. Someone would dispose of it according to hospital protocol, like it was medical waste, like it wasn't part of a human being who'd worked with his hands for 16 years. That night, I went home and couldn't stop washing my hands, scrubbing them under scalding water until my skin turned red, like I could wash away what I'd done. After the surgery, I did what I always do in difficult cases. I went to the records room and documented everything, every conversation, every decision point, every medical justification. But this time, I also documented something else. Something that could get me in trouble with hospital administration, but that I needed to have on record: patient-elected amputation over limb salvage, primarily due to financial considerations rather than medical factors. Insurance authorization delays and high out-of-pocket costs created a scenario where patient felt forced to choose less optimal medical treatment due to economic constraints. This represents a systematic failure in our healthcare delivery system. My department head called me in the next week. Dr. Chun, I saw your note in the Harrison file. Yes? You can't put things like that in medical records. It opens us up to liability. Liability for what? Telling the truth? He closed the door, sat down across from me. His voice dropped. Sarah, I'm going to be frank with you. Administration has flagged your documentation patterns. You're creating a paper trail that suggests systemic failures. If a lawyer gets hold of these records, good, I interrupted. Maybe they should. You could lose your privileges here. You understand that? I looked at him for a long moment. This man had been my mentor, had written my recommendation letters, had celebrated when I'd successfully completed impossible surgeries. I understand, I said, and I no longer care. His face softened. Sarah, I know this case hit you hard, but this is the system we work in. We don't make the rules about insurance authorizations and patient cost sharing. We just follow orders? I said, just turn human beings into financial calculations? Just ask people to choose between their bodies and their bank accounts. We do the best we can within the constraints we're given, he said quietly. And that was the problem, wasn't it? We'd all accepted the constraints. We'd all learned to work within a broken system instead of fighting to fix it. 3 months after the surgery, I saw Marcus for a follow-up appointment related to his prosthetic fitting. He was doing okay physically. The prosthetic was working reasonably well. He was adapting to life with one arm. But when he first looked at the empty space where his arm used to be, he didn't cry. He just stared, like he was waiting for it to reappear. Like his brain couldn't accept that it was really gone. I could see the emotional toll now. The second guessing. The what-ifs that would probably haunt him forever. Do you regret it? I asked him. The decision? He was quiet for a long moment. I regret that I had to make it at all, he finally said. I regret that in America, your body parts have price tags. I regret that you had to be the one to ask me that question. I'm sorry, I said. I know you are, he said. And I don't blame you, Dr. Chun. You were trying to save my life. But the system ... The system wanted to save money. And money won. After he left, I sat in my office for a long time thinking about what he'd said. He was right. The system had won. And I'd been its instrument. I started keeping track after Marcus. Not officially, just a list I kept in my desk drawer. Every patient where insurance barriers, cost considerations, or authorization delays affected their treatment. In 6 months, I had 43 names on that list. The woman who chose to keep her infected leg because amputation meant losing her job as a waitress, she needed to be on her feet. The man who declined chemotherapy because he didn't want to leave his wife with $200,000. In debt, he died 4 months later. The teenager whose parents had to choose which of his 2 necessary surgeries they could afford. They picked the one that would let him breathe, not the one that would let him walk without pain. 43 Marcus Harrisons. 43 people who couldn't get the care they needed, or had to settle for lesser treatment, or went into crushing debt, or made impossible choices between their health and their finances. I thought about quitting, thought about finding a different career, something where I wouldn't have to choose between my ethical obligations and systemic constraints. But then I realized, if I quit, someone else would just take my place, someone who maybe cared less, who wouldn't document the failures, who wouldn't push back even in the small ways I tried to. So I stayed. But I changed. I started talking to patients about the system earlier, explaining that insurance denials can be appealed, that there are sometimes hardship programs, that they have more power than they think. I started connecting patients with social workers before the financial crisis hit. I started pushing back harder against insurance companies, making phone calls I didn't used to make, writing letters of medical necessity with more aggressive language. It doesn't fix the system, but it helps some people navigate it. 6 months after Marcus's surgery, I got a call from the hospital's risk management department. Morrison Manufacturing's workers' compensation insurance was disputing their obligation to cover Marcus's case, arguing that since he'd chosen a non-medically necessary amputation instead of fighting for limb salvage, they shouldn't have to pay full benefits. The irony was staggering. Marcus had chosen amputation to avoid medical debt, and now he was being financially penalized for that choice. I wrote a 15-page letter to the workers' comp insurance company, explaining in exhaustive detail why the amputation was absolutely medically justified given the systemic barriers that prevented timely limb salvage. I cited every relevant medical study, every protocol, every ethical guideline. They settled for 70% of what Marcus deserved. The system won again. I saw Marcus one more time about 8 months post-surgery. He'd adapted well to the prosthetic, all things considered. Found a new job, though it paid less than his previous work. His family was managing, though the financial strain was obvious. "How are you doing?" I asked, meaning it as more than a medical question. "I'm alive," he said. "I'm adapting. But every time I strap on this prosthetic, I think about that day in the hospital, about being asked to choose, about living in a country where that's a normal question to ask someone." "I think about it too," I admitted. "Every day. Do you regret asking?" I thought carefully about my answer. I regret that I had to ask. I regret that the system forced us both into that position. But if I'd stayed silent about the financial reality, and you'd chosen limb salvage without understanding the costs, and your family had ended up in catastrophic debt, I'd regret that too. There was no right answer, Marcus. The system made sure of that single. Quotes, he nodded slowly. Maybe that's the real problem. Not the doctors, not even the insurance companies individually, but the whole structure that makes these situations possible in the first place. Yes, I said. That's exactly the problem. After he left, I updated his file one final time. Documented his progress, his adaptation, his functional outcomes. And then I added one final note. Patient adapting well to prosthesis. However, continues to experience psychological impact from having been forced to make medical decisions, based primarily on financial rather than clinical factors. Outcome represents a systematic failure that extends beyond individual clinical encounter. My department head will probably call me in again about that note. But I don't care anymore, because someone needs to document what's happening. Someone needs to create a record of how the system actually works, not how it's supposed to work. Someone needs to say out loud, "This is wrong." My name is Dr. Sarah Chun. I'm a hand and orthopedic trauma surgeon, and 8 months ago, I asked a patient to choose between his arm and $80,000. Not because I wanted to, but because the system left me no choice. That sentence, those 11 words, will haunt me for the rest of my career. Not because I did something wrong as a doctor, but because I participated in a system that is fundamentally, systematically wrong. Marcus isn't the first patient I've had to have this conversation with, and he won't be the last. The system that forced us both into that impossible position is still functioning exactly as it was designed to, until we collectively decide that healthcare is a human right rather than a commodity. There will be thousands more Marcus Harrisons lying in hospital beds, forced to put a price tag on their own bodies, and thousands more doctors like me asking questions we never wanted to ask, participating in a system we know is broken, and wondering if there's any way to fix it before it destroys us all. The surgeon said, "You choose. Save your arm or pay $80,000. But what I really said was, "I'm sorry. I'm so sorry. The system has failed us both. Before I close this story, I need to ask you something personal. After everything I witnessed that day, I still ask myself every single day, what would you have done in my position? Maybe you think the answer is obvious. Maybe it's not. But hearing other voices, other perspectives, other experiences helps me understand that I'm not alone in facing these impossible choices. Because sometimes the only thing that sustains someone after participating in an impossible decision is knowing that someone out there is listening. Leave your answer in the comments. I want to read it. I really do. Hit like if you believe no doctor should ever have to ask a patient to choose between their body and their bank account. And follow me here on this channel because every week I share real medical stories that shouldn't exist. Stories that can open debate, awaken empathy, and maybe help someone who today feels as lost as I felt that day. Thank you for being here. And thank you for letting me hear your voice too.